And welcome back to our final interview at the World Healthcare Congress 2018. Thank you so much for joining us today. I'm back now with Emily Stewart, who is VP of Public Policy at Planned Parenthood Federation of America. Emily, thank you so much for your time.
Thank you so much for having me.
Well, you just finished a panel which was talking about healthcare transformation and the role of women in that process. Are we finding that women have had a softer voice in terms of being able to talk about where they want their health care and how it should look like?
I don't think that women have had a softer voice as much as people are not as attuned to what women are asking for in healthcare in this country. At Planned Parenthood, we serve 2.4 million people every year. 1 in 3 American women will have come to Planned Parenthood at some point in her lifetime. And so we know a lot about what women need in the healthcare system. And it should come as probably no surprise to most women, but women's healthcare needs and their healthcare preferences are very unique. They're very different. The challenge is that women's preferences and needs aren't really being accounted for in current healthcare system transformation efforts, and that's a part of what we were trying to talk about at today's panel this afternoon.
How good of a time is it right now for women to really put up their hand and say, this is something we want to change for the better?
It's hugely important, and it's exactly the right moment for healthcare providers, payers, to be listening to women as healthcare consumers in terms of what they want and need. At Planned Parenthood, we did some research to try to get some answers in terms of what women are asking for. And there are really 2 takeaways in particular for women of reproductive age. The first is that the primary healthcare services that they are coming to the system for, that they need, are reproductive health related services. So cervical cancer screenings, breast exams, birth control, STD testing, and treatment. And the other thing that we found is that women have a very unique relationship with their OBGYN providers, including women's health centers like Planned Parenthood. By 25-point margin, they're more likely to be open and honest with an OBGYN provider than other healthcare providers. So those 2 things taken together tell the story of why it's so important to be thinking about what women need, and in particular how they want to access the healthcare system, how they want the system to acknowledge where they need to be getting care.
And what are some of the priorities that they're trying to get attention on?
Number 1 would be making sure that OBGYN providers are connected into transformation models. So whether it's a medical home model or a care coordination model or a behavioral health model, women are asking that those models allow them the opportunity to choose their OBGYN provider as a centerpiece in their healthcare delivery. In fact, 90% of women in the survey that we conducted said that they want to have that choice. Only 14% said that they felt like they had it today.
Oh, I see. And what about screening? We've had a lot of discussion about mammogram screening. So for cervical cancer screening, there are very set guidelines regarding that now. Is that something that Planned Parenthood is also looking at in terms of making some changes or advocating for change?
Well, we have been around for 100 years, and for just that amount of time that we've been delivering care, we have also been doing a lot of work to help the healthcare community set standards that demonstrate what quality women's health care looks like, and that has included working with entities like the CDC and the American College of Obstetricians and Gynecologists to set out strong women's health standards, and we're committed to continuing to do that work. I think one of the challenges today with respect to screenings is actually more on the access side, making sure that people, no matter where they live, no matter what their income is, no matter what their background, has access to affordable health care and screenings. And so that's absolutely something that we are working on. So for instance, for women of color in particular, they are less likely to access cervical cancer screenings when they need to, and that's something that we at Planned Parenthood have been working on and working towards, especially in the policy and advocacy space, trying to make sure that that care is more affordable.
What's another message that you'd like to leave with our viewers?
I just want to make sure that people understand how important it is that we think about women's unique healthcare needs and preferences as we're developing models, and to do that on the front end. It seems too often women's healthcare needs and preferences are contemplated after a model has been developed. Some of the one-size-fits-all models that we have been developing as a part of trying to achieve the triple aim in healthcare quality don't think about at the outset how women access the system differently. And I would really hope, and am hoping that people will understand how important it is that we make that shift, to make that change in orientation and start thinking more about women of reproductive age at the outset of these discussions.
Okay, and how are you finding the conference this year?
It's great. It's wonderful. It is so great to see all the different people who are speaking, from Secretary Azar to others, and hearing multiple perspectives.
All right. Thank you so much for your time today, Emily. Appreciate it.
All right. Thank you.
And I'm Mabel Jong. Thank you for watching. And for all of us here on the WHCC18 team, we'll see you next year.